Your breastfed baby's diapers can give you a lot of information about how breastfeeding is going, but there are a lot of myths and misinformation about what you should expect. If you want to know what the accurate information is, stick around. Hey mama, welcome to my channel, Breastfeeding Confidential, where I talk about all things breastfeeding. My name is Andrea, I'm a registered nurse and a lactation consultant, an IBCLC, and I've been helping moms and babies breastfeed for over 27 years, and I want to help you too. If you're looking for breastfeeding information, education, support, and tips, then I invite you to hit that subscribe button and that notification bell so that you don't miss out on any of my helpful videos. I want to talk about what is normal for a breastfed baby in terms of diapers, how many you should expect, what it should look like, and it's going to change as your baby gets older. What you should expect on day 1 is going to be completely different from what you should expect on day 7, and that can be very different from what you expect after a couple months. So let's start at the beginning. In the first 24 hours, a breastfed baby should have at least one wet diaper and at least one soiled diaper. That first soiled diaper and in those first few days is going to be what's called meconium. And meconium is black, dark green, sticky, tarry looking stuff. It's a joy to change those diapers, not. Now in your baby's second 24 hours, we expect at least 2 wet diapers and 1 to 2 soiled diapers. Probably still going to be meconium. Now in the third day of your baby's life, you should expect a wet diaper at least once every 8 hours. So we're looking for 3, but it should be at least once every 8 hours. And again, 1 to 2 soiled diapers. At this point, dirty diapers might start to look transitional. Transitional stools are a greenish brown. They're kind of a combination of the meconium and what the baby is producing from the colostrum that he's been drinking. Now, until your milk comes in, we expect him to continue to have at least 3 wet diapers every 24 hours, about 1 every 8 hours, and 1 to 2 stools. Sometimes there may be a lag with the stools, but they shouldn't go days without a stool. The milk usually comes in around the 2nd to 4th day. And within 24 hours of your milk coming in and flowing, that's when you hear lots of swallowing, you should start to see what we call breast milk stools. A breast milk stool is loose, yellow, runny. It might look curdy or seedy is sometimes used to describe how it looks. Now, when a baby is getting enough breast milk from breastfeeding, you should see at least 3 to 4 yellow runny stools in a 24-hour period of about moderate quantity, about that much in the diaper. It has to be at least the size of a quarter to even count. If it's smaller than that, you don't even get to count it. Now, most babies are going to have a combination. They'll have some small stools, they'll also have some moderate quantity, and then they'll have those diapers that are a joy to change where it goes up the front, up the back, and out the sides. And that's considered a large stool. You also expect the wet diapers to increase after the milk comes in. You should be seeing about 6 wet diapers every 24 hours. So we consider it a reassuring sign that a baby is getting plenty of breast milk if we're seeing at least 6 wet diapers in a 24-hour period and at least 3 to 4 stools in moderate quantity on average of loose yellow runny stools. Now you may have heard that breastfed babies can go days without pooping, and that's okay. And that can be true, but not until a baby is at least 6 to 8 weeks old. If there is less than those 3 to 4 diapers in those first 6 to 8 weeks, it can be a red flag that a baby is not getting enough to eat from breastfeeding. So if you're seeing an insufficient number of bowel movements in your baby's diapers, then you would want to get a weight check. Weight gain trumps everything. If a baby is gaining enough weight, then everything is good. If a baby is not gaining enough weight, it doesn't matter how many diapers they're having. Now, after that 6 to 8 week period, some babies will continue to stool frequently, and other babies will have a bowel movement. Sometimes it will go several days between bowel movements, and as long as they're gaining weight, that's okay. Wet diapers may decrease a little bit as a baby gets older, but not by a large amount. They may go to like 4 to 5 a day. The other thing I want to talk about is the color of a baby's bowel movements. Now, I said a breastfed baby will typically have loose yellow runny stools that will often look seedy or curdy. Now, sometimes you might see a green stool, and this can be caused by a couple different things. Green stools can be caused if a baby is getting too much of the foremilk. That's the milk that they get when they first start breastfeeding. As the breast empties, then it gets higher in fat content, and that's called the hind milk. If a baby's getting a good mix of those, they'll usually have those mustard yellow stools. But if a baby's getting primarily foremilk, they may have green stools. Another thing that can cause green stools is a virus or bacterial infection. And then the other thing that can cause green stools is food intolerances. Now, when green stools are caused by foremilk, they are often described as looking frothy in addition to being green. Whereas when a baby has a food intolerance or an infection of some kind, those stools might look mucousy. Now, some people think that a breastfed baby's stool looks like diarrhea because it can be so loose. But as long as there's not a large water ring around the stool, then it's not considered diarrhea. It's just the way breastfed baby stools are. Now, an occasional green stool in a baby who's happy and gaining weight is really not a cause for concern. So that is the scoop on baby poop and diapers in general. I hope you found this video helpful. If you did, please give me a thumbs up. Please subscribe and leave a comment if you have any questions. Until next time, Mama.